Are you waiting for nursing school? Here's 5 ways to gain experience and why you need the experience. Hi guys, I just want to start off. Please forgive my eyelashes. I don't know what's going on with them. They're brand new and I think they're just not really, worked in the corner. So they look a little bit funny even to me, but that's okay. Also, I know I bite my lips when I get stressed, and so nursing school has me stressed out, so I've been biting them and it's not a good look because they're healing at the moment. So just don't mind all this going on right now. Just listen to the content, subscribe to my channel, and I'll get you some more nursing videos out. Whatever you guys have questions for or info that you guys need, or just somebody else to explain their journey, I'm here for you guys. And so today we are gonna get into things that you can do while you're waiting for nursing school to gain some experience. Alright, now it's good to gain experience before you go into nursing school, because you don't want to go in there with absolutely no clue of what you're doing, what you're hearing, what you're seeing. It's all going to be a complete shock to you. And if you gain a little bit of experience before you go ahead and get into nursing school and start buckling down in those books, it will help you and have your confidence already higher than others that don't have even just a tiny bit of experience dealing with patients or situations or blood, because I know a lot of people don't like blood, and if you're going into nursing, that might be something you want to figure out beforehand. So a little bit of my background: I am currently a certified medical assistant, and yes, I did this while I was waiting for nursing school. I know sometimes the wait list can be years or maybe just a summer, but there's definitely ways you can gain experience. So when I knew I wanted to become a nurse, I decided to start taking my classes in college and doing all of that, but I wanted to get my feet wet beforehand. Even have my foot in the door at a facility where I could possibly get hired once I was done. So what I did, I decided to apply for a position as the front desk. I think they're called patient service representatives at most hospitals or clinics, and I decided to go into urgent care. I knew that I was going to see a ton of stuff that I had never been exposed to before, deal with patients, deal with doctors and the nurses, and just gain a lot of experience. I got lacerations and back pain and urinary symptoms and a broken this, a broken that. I have a headache, I've been vomiting. All different types of situations that you wouldn't necessarily deal with before you go into nursing school if you're not in a medical facility already. Along with being in a medical facility, you get to start hearing the way nurses and doctors speak, the medical language, because it literally is like a second language to some people. You start to understand more and more about the words that are being spoken and what they mean and different signs and symptoms. You kind of get to start talking and speaking like the nurses and the doctors. You get that medical lingo going, and it is very helpful once you start the nursing program, because once you start reading those books, there will be words in there that you have no idea what they're talking about. But since you worked in a medical facility and you've heard those terms before and you've looked them up and you've done a little bit of homework behind them, you'll definitely understand a little bit more than you would if you hadn't have started researching anything per nursing. So for me, I decided to become a medical assistant. Yeah, you can say that some programs are super long to get that done, but I had a little bit of time to wait. I had about a year to wait for nursing school, and I decided to become a medical assistant after I had a mishap before, although that entire mishap will be an entirely different video. So yeah, I decided to go to medical assistant school. My program was only 3 months long, and then I would say maybe another month for the externship, so a total of 4 months. And I was still working at the front desk in urgent care. It was just part-time now instead of full-time, and I absolutely am so grateful that I did that. It got me to know even more in depth how to do things. I could do med pass and injections, and my vitals were top notch. I had a ton of practice. I even got to do phlebotomy in it. So just a ton of skills that I had learned in medical assisting school are definitely helping now in nursing school. Already having that knowledge and that practice of hands-on experience with actual patients, and having my own doctor and being with other nurses, and even having experience dealing with the hospitals and going to the hospital for my doctor and just helping him out in any which way I could, really makes me feel like I have a little bit of upper hand from my class, because I have prior knowledge, prior experience, and I'm able to help my classmates as well as you guys. That's what I'm here for. Any knowledge that I have, I want to give it to you guys. I'm going to be able to share what I've learned, share what I know, all the failures that I have gone through and the mistakes I've made. I just want to let you guys know that I'm here if you have any questions, any concerns, if you need, to help out the pathway of nursing school, or to find other things that you can do before nursing school, just to give you guys a little bit of an upper hand, a little bit of experience before you step through those doors on the first day of nursing school. I did a lot of things that definitely helped me in nursing school. The medical terminology was tremendous help. Knowing what was going on and what my doctors were talking about and what the nurses were talking about, I could definitely relay my message to them in a medical verbiage and have them understand me completely, just like I understood them when they were speaking to me with their medical verbiage. So that's another way to get your feet wet, is to become a medical assistant or even a CNA. You can even decide to be a CNA. That is also extremely helpful. I'll go into it later and probably in another video why I did medical assistant over CNA, but it is also great experience. Like, even one of my classmates, she's a CNA and she works in the hospital. And honestly, I am a little bit jealous that she could still work in the hospital, because I was just at a private clinic, but my clinic was huge, so I had a ton of opportunities. But I really wish I would have gone more of the hospital route, because eventually that's where I want to end up working, is in a hospital on the floor, hopefully in trauma or emergency room. Those are my top picks. And before I even applied to nursing school, I decided to just see what it was all about, especially the emergency room. So I decided to volunteer. Volunteering is another great way to get a little bit of experience. Even though you're not getting paid for it, you get to help patients, talk to patients, see what's going on, see what nurses do, see what doctors do, see the different facilities like the x-ray, the CT, the MRI rooms or areas. It's definitely a great way to get your feet wet, to understand what's going on around you, to understand what you'll be getting into as a nurse, and just to see some pretty cool stuff. Granted, patients, let me just clarify for all of you that, didn't like that statement, things that patients are going through aren't cool, or it's very sad when people are sick and hurt and just, are not doing the greatest in their life. And that's the thing, they're coming to you, they're coming to the doctor, they're coming to the nurse for your help. And I personally think that that is awesome, that I have the skills, the knowledge, the accessibility to help these patients, to help them get better, feel better, be able to assess them and know what's going on with them, just to make them feel better. I really just want them to be better. So that part is the part that I think is cool. And yes, surgical incisions and really crazy wounds, yes, those are very cool to see too. Not for the patient, obviously, but for you to see that, wow, oh my gosh, this person's leg is completely open. Like, what can I do? I know what to do to help this patient, to clean it out, to debride it, to wrap it up, to put antibiotic ointment in it. Anything that you can do to help them is amazing. And the fact that you know how to do that for a patient, I think is extremely cool. I know cool isn't the word, but it is an awesome feeling when somebody's coming to you for help and you know exactly how to help them. So far we have being a front desk person, becoming a medical assistant or a CNA, and volunteering. Those are 3 very good things. Now, of course, you can become a radiology tech or a phlebotomy tech, or just work in the clinical side, like in the back of the lab doing urinalysis and blood testing. You can do almost anything before nursing school if you want to, even sterilization. It's just the fact that you need to get your feet wet in some sort of way before nursing school. It is a very good idea, very good advice to try to get that done, because then you'll have even more knowledge to take into your nursing before you even get there. Now, granted, if you don't and you don't have time to do it, that's okay. You'll learn all of this in nursing school. They'll teach you. You'll get your feet wet in nursing school. You'll know how to deal with patients, talk to patients, and everything. It's just that doing it beforehand will make it an easier transition for you. You won't be scared to talk to the patients, scared to touch the patients. You won't be nervous at passing out meds or giving injections, or, you know, cleaning a wound in the sterile technique, and, you know, knowing exactly how to wrap the wound up. If you already know how to do that, you'll be so much more confident out on that floor. I can't tell you how much it really has helped me. Even if you're not able to get a job in the medical field, that is okay before nursing school, that's okay. Just start, you know, looking up your medical terminology, looking up different normal signs and symptoms of, you know, diabetes and urinary tract infections or hypertension, the normal diseases that people do go through. Often enough, you'll see so much in clinicals. Just go through them, the signs and symptoms that you may see. Sorry, the brownies are done. Give me 1 second. Medical terminology. They even have medical terminology courses at most junior colleges, so you can always enroll in that and get your you know, knowledge going with understanding the medical terminology and how things are pronounced and how things look and come across and are spelled. Like, some of those words are so long, like you'll read it and be stuck for a good 3 seconds trying to just break the word down. But once you get it down, you can read those things like nobody's business. So, another thing that you can do is, if you know, don't really have time for any of this and you don't have time to go back to school, or you're done with school for now, you just want to have a little bit of a break, see if you have any family members that are in the medical field. Most of the time, that's why we like to get into the medical field, because we have family members that do it as well. We see, you know, all the stories that they have and the experience that they have, and they, you know, the money that they get. That's not the main thing, but it's also a very nice perk. You can talk to them and see if there's any way that you can shadow them at work, or even if you don't have a family member, see if you can go to your local, you know, clinic or doctor's office or hospital and talk to the volunteers desk or talk to HR. Anything, any way that you can get your foot in the door. If you can shadow, you know, a nurse for one of their shifts or a part of their shifts or just a few hours, anything that you can do to see beforehand what you're getting yourself into, being in the environment, seeing situations, surrounding yourself with medical personnel, you know, it's always a great idea. It'll definitely boost your confidence and make you feel like you're making the right decision. And if you still don't know, that's okay. You know, you have time, you'll figure it out. You'll be in nursing school, you'll be able to figure out your niche, whether you like pediatrics or adults or gerontology or podiatry, or if you want to go to trauma or ICU or this, you know, just med surg period. They have med surg floors. Those are a great way to start. You know, just get your feet wet, try to get experience any way you can, and do your little bit of research, do your little bit of homework. It'll definitely give you a little boost of confidence, and just, you know, excess knowledge that you can get so that you can utilize when you're in nursing school. So I hope this helped you guys, and I hope that, you know, you can give me some more suggestions. Oh my goodness, I cannot talk today. Some more suggestions and more options. If you have your own story about, you know, what medical field you did before nursing school, or, you know, the experiences that you had beforehand that actually helped you, please let me know. Please comment me below. Please like and subscribe. I'll put up some more videos for you guys. I hope you like this one. Bye, loves. Have a good day.